Dr. James Benenati has been making a difference in the lives of patients and the field of interventional radiology for over 3 decades. He's the medical director of the Non-Invasive Vascular Laboratory at the Miami Cardiac and Vascular Institute at Baptist Hospital, where he's practiced since 1990. He also serves as the head of IR at Radiology Associates of South Florida. His educational journey has taken him from undergraduate studies at Notre Dame to medical school at the University of South Florida to his diagnostic radiology residency at the Indiana University School of Medicine, along with his fellowship in cardiovascular and interventional radiology at Johns Hopkins, to positions of leadership at 2 esteemed Florida universities. Dr. Benenati is a clinical professor of radiology at the Herbert Wertheim College of Medicine at Florida International University, where he serves as vice chair of the new Department of Interventional Radiology, one of the first of its kind in the nation. Dr. Benenati is also a collaborative professor of radiology at the University of South Florida Morsani College of Medicine. As a former FSIR president, past chair of the annual meeting, and 2014 daughter lecturer, Dr. Benenati has been a tireless champion of the IR specialty from almost every angle, from clinical research projects and national trials to legislative advocacy through SIRPAC. Dr. Benenati is the founding medical director of the Nova Southeastern University Health Sciences BSRVT program. He served as president of the vascular division for the Intersocietal Accreditation Committee and has spent more than a decade on the IAC Vascular Testing Board. He has also served as a program director of the International Symposium on Endovascular Therapy for 30 years. His clinical areas of expertise include peripheral arterial disease, abdominal aortic aneurysm therapy, management of pulmonary embolism, management of acute clot, and uterine fibroid embolization. Dr. Benenati is married to Dr. Susan Benenati. They have 3 children, and Dr. Benenati is one proud grandpa. He also has enduring professional relationships with IR colleagues who were eager to share their congratulations.
Well, it's a pleasure for me to make a few comments about Jim Benenati, who I've worked with for nearly 30 years. Jim helped establish Miami Cardiac and Vascular Institute in the early years and has worked side by side with me during that time as we've been able to develop together an incredibly integrated interventional radiology program, but also a multidisciplinary program for cardiac and vascular disease. Jim has also been a pioneer. He's helped us innovate new procedures here at the Institute. He's been a great representative of interventional radiology in a multidisciplinary forum that we have. It's a great chance for me to recognize Jim publicly within the society. He's been a great contributor to interventional radiology and our society, and it's a great privilege and honor for me to have worked with him all these years. Congratulations, Jim.
My appreciation for your many contributions to our specialty and the SIR is only superseded by my respect and admiration for your unwavering love, kindness, and commitment to your wife, children, brother, friends, and colleagues. Not only are you an amazing and gifted interventional radiologist and leader, but more importantly, you're a wonderful human being. I feel very fortunate to be able to call you a friend and colleague. You truly embody what the SIR Gold Medal represents, even if it is sometimes clouded by your blind passion for and allegiance to Notre Dame football. Congratulations to you, Sue, Lauren, Nick, and Matt on being awarded the SIR Gold Medal.
Yeah, there aren't many people like Jim Benenati. In fact, there's no one like Jim Benenati. No one does things quite like Benenati. In fact, the Benenati-isms, the sayings, the flair, the ability to drop the right comment and context for which we're dealing with a major crisis or sorting out a dilemma or a major problem within our specialty or within his clinical practice or anything he's dealing with. He just has this innate ability to put it in perspective and figure out the right solution and really have those members behind him follow his lead. And that calmness in the storm is really unique. Not many people have that, and he has done it every step of the way throughout the entirety of his career. And I think that's pretty special.
So Jim, I cannot be happier to congratulate you on this gold medal. I think it's incredibly well deserved. You are just absolutely one of my favorite people in this specialty. I've known you for a long time. You have helped me in so many ways. You have helped the specialty in so many ways that I think the gold medal is just a beautiful way to sort of acknowledge that. I can tell you for the audience that Jim is just one of those people that can connect with everybody. And when he walks into a room, everybody kind of turns to kind of see what he's going to say, because they know it's either going to be really, really smart, really, really funny, and often it's both. So Jim, congratulations. My only regret in all this is that COVID-19 has chosen this year to get in the way of our meeting, and so you don't have a huge audience of people to cheer you on. So you can hear me clapping for you, and imagine several thousand more people.
The Society of Interventional Radiology is honored to recognize 2020 gold medalist Dr. James Benenati.
Hello from Miami, Florida. It's a great privilege and a pleasure to be able to accept the Gold Medal Award from the Society of Interventional Radiology for 2020. I wish we could all meet in person, and hopefully these virtual meetings will be coming to an end soon. So let's hope next year we can all meet together and celebrate. Now, I may be the first person in SIR history not to accept this award outright. I'm going to accept this award, but there are certain conditions that must be met in order for me to accept the award. So let me tell you what those conditions are. I'll only accept this award if all of my partners who I've worked with, past and present, understand that this award is equally theirs. You see, this is an award given to one, but it's actually earned by many. And my partners not only have been wonderful friends, best friends, they've been encouraging, supportive, nurturing, and helpful. And I have to tell you, the past 31 years working in our practice has been nothing but a pleasure and a privilege. And to describe it literally, it's been a lot of fun every single day. So thanks to all of them. And if they're willing to accept this, then I'm willing to accept it. The second condition is that all the fellows who we've ever trained, past and present, understand that they're equally as responsible for me winning this award as anyone else. They're the catalyst for new knowledge. Their inquisitiveness and their desire to learn has stimulated me and all my partners for the past 30-some years, and we're very thankful to all of them, and I acknowledge all the contributions they've made. Thirdly, the third condition is that the leadership in the SIR and the staff in the office understand that with their support, help, mentoring, and friendship, I was able to achieve a lot in our society, but they deserve a lot of the credit. A phenomenal group of people, and I'm very thankful to all of them. Fourthly, I'm thankful to all of you, many friends and colleagues who have been encouraging over the years. I want you to feel that a part of this award is yours as well. And finally, and I think most importantly, I can't accept this award unless I acknowledge that the value my family has and how deserving they are really of me winning this award. My children, Nick and his wife, Kat, Lauren, her husband, Dan, and grandchild, Maggie, and my son, Matt, are all really the people who have motivated me and pushed me. They call BS when BS needs to be called, which is quite often. And they've been super supportive. But most important in all that is my wife, Sue. For over 35 years, she's nurtured, supported, and encouraged me. She's been the port in every storm. She has been the bright light in all the darkness. She's made everything good happen in our life, in our family life, and in our work life. And really, she is as deserving of every award that I've ever won as I am. And I can't thank her and tell her I love her enough. So if all those conditions are met, I'm happy to accept this award. And I thank you all very, very much.